Hello, good morning, good afternoon, good evening. How is everybody doing today? Today, we are excited to be talking about learnings from leaders around the world, specifically focusing on the FIP Asian region. I want to thank you all for joining, and I'm so excited to see where everyone is joining us from all around the globe. As you are putting your information in the chat, we look forward to hearing what your background is and what category of practitioner you belong to. I also want you to know that I will be moderating today's session, and we will begin through our series of questions used throughout the series in our regions as well. To start, I will call on each speaker to ask for their insights, and then I will ask that they give their thoughts, and we will look at some speaker themes, and we will summarize towards the end. We will also invite your thoughts and ideas concerning the subject matter today. First, I want to recognize some of the superstars who have really planned this meeting. John Y. Mai is the session lead. He's head of pharmaceutical chemistry and faculty of pharmaceutical sciences of UCSI University and assistant honorary treasurer of the Malaysian Pharmacists Society. Thank you, John Y., for all your great work with this program. Next is Janine Abrams, who is a series coordinator, and she's the director of the International Student Pharmacist Activities and co-director of the University of Iowa Mobile Clinics. And she's clinical associate professor of the University of Iowa College of Pharmacy. Thank you, Janine, for your excellent coordination of these series. I want you to know that there is a Zoom poll that will be started, so make sure that you're able to use these to provide the responses that will help guide our conversations. Throughout the session, make sure to share your thoughts and experiences in the poll, but also you can use the chat feature. One of our facilitators will be harvesting information from the chat feature so that we'll have a great session today. Next, I would like to introduce the format for the webinar. The format for today's webinar and all of the webinars in these series, you will see we will get to spend about 1.5 hours today hearing the insights of our speakers. We hope this helps them successfully share their perspectives on managing change in their region. At the end, we'd like to hear from you as well. John Y., the regional coordinator of our series, will monitor the chat with Janine, and they'll give us some of the themes of the questions to help us to get our questions answered at the end of the session today. We'll also talk about the next steps, as we'd love this to be the start of our continued involvement with our working group, and we will share how you can learn and share more. Again, if you're just joining us, this is the event series, the Academic Pharmacy Section event series on academic policy and advocacy working group, learning from leaders around the world, focusing on the FIP Asian region. All right. Since this is a live discussion, just know that we're going to be recording this. Thank you for joining us from all around the world. I'm going to direct the conversation to ensure we get through all the questions. Each speaker will briefly summarize their current roles. We'll have on the slide some of their notable accomplishments in our profession as each speaker takes their turn. I'm going to introduce today's speakers now, and we're really excited to see those who have joined us already. In no particular order, I'm going to start with Yolanda Robles. Dr. Yolanda Robles obtained a BS in pharmacy from the University of the Philippines and finished a master's and PhD in pharmacy from the University of Tasmania in Australia. She has worked with the University of the Philippines for 25 years. Her current positions include professor at the College of Pharmacy. She's a technical expert for the TESDA Pharmacy Services National Certificate, and she's a training director of MedExpress Outpatient Pharmacies and a training consultant, module developer, and facilitator for various community and hospital practice pharmacy services. Some of her numerous leadership roles include president of the Philippine Pharmacists Association, past president and now honorary advisor of the Asian Association of Schools of Pharmacy, country chair and past president of the Asian Conference on the Clinical Pharmacy, and the current Secretary General of the Federation of Asian Pharmaceutical Associations. She's also Dean of the University of Philippines College of Pharmacy, and she served there for 2001 to 2007. She was President of the Philippine Association of Colleges of Pharmacy from 2004 to 2006, member of the Philippines Department of Health as a National Formulary Committee member, and researcher and trainer in pharmaceutical supply chain management. Her research focus is in health policy, pharmacy, education, and practice. Work has led to publications, practice articles, and presentations at national and international conferences. Let's give a cyber round of applause to Yolanda Robles. Our next speaker is Emerson Ichi Inoue. His current role is Professor Emeritus, appointed in 2010, and visiting professor of Kyoto Pharmaceutical University, where he received his Bachelor's of Science, his Master's, and PhD in Pharmaceutical Sciences. He has been serving as president of the Japan Society for Pharmaceutical Education since 2016. Previous positions have included Harvard Medical School, Massachusetts General Hospital from 78 to 79, Department of Pharmacy, Kyoto University Hospital Service, 79 to 90, and his research interests include functional and molecular characterization of drug transporters and clinical application, pathophysiologic roles of drug transporters and mechanisms of drug interaction, pharmacogenomics of personalized medicine, and from bench to bedside and from bedside to bench. His publication roles are varied. They include Associate Editor for Pharmacology and Therapeutics, Editor-in-Chief for the Journal of Asian Association of Pharmacy, member of the Editorial Advisory Board of Biochemical Pharmacology, member of the Editorial Advisory Board for the European Journal of Pharmaceutical Sciences, and his awards and honors include highly cited researcher in pharmacology and toxicology and Web of Science. Please give a round of applause to Dr. Kenichi Inoue. Next, we have a next speaker is TV Narayana. He's known for his roles in education, combining academic excellence, entrepreneurship, organizational and management skills, leadership qualities, and enthusiasm for our profession. Over 30 years of work in this area. He has a B.Pharm and M.Pharm from Andhra University and a PhD from ANU. His current roles include Director of Vikas Institute of Pharmaceutical Sciences, member of the DTAB Ministry of Health, and FW for the Government of India. Past roles include National President of the India Pharmaceutical Association from 2018 to 2020, General Secretary of the Indian Pharmaceutical Congress Association from 2019 to 2022, and he had 3 consecutive terms, President of the SEAR Farm Forum WHO Southeast Asia region from 2020 to 2022, and member of the Board of Directors of the Asian Association of Schools of Pharmacy. He has several honors, state and national merit scholarship holder, winner of the SRI BV Patel Trust Memorial Scholarship, and international FAPA Ishidate Award for Pharma Education from the Federation of Asian Pharmacists Association. He has lots of other notable bio informations that we should know. He has presented widely. He has conducted several student congresses, several scientific papers, guided over 45 PhD students, presented over 100 papers at WHO, FIP, FAPA, and AASP. Let us give a strong round of applause to Dr. TV Narayan. Last but not least, we have our final speaker today is Amrahi Boang, and basically has a Bachelor of Pharmacy with honors from the University Sans in Malaysia. Roles include current president, house pharmacist in HKL and MUSPJ, 35 years of service at University Malaysia Medical Center, Kuala Lumpur, as a pharmacist, senior pharmacist, chief pharmacist, and deputy director from 1980 to 2015. He's also a halal pharmaceuticals consultant, a freelance business coach for pharmacy, and past contributions to MPS. He has worked tremendously with the Malaysian Pharmacist Society as the chairperson of the RUUF task force, spearheaded MPS efforts in handling the new pharmacy bill and dispensing separation issues. From 2016 to 2018, he served as president, leading organizational change and branding, set up the media and publicity chapter to improve MPS image, created a strategic plan for MPS and rebrands the annual MPS seminar to the National Pharmacist Convention. He's serving currently as president from 2018 till now and has done quite a bit of work with the MPS Constitution involving a name change, inclusion of presidents Sabah, PS, and Sarawak in the council, as well as the formation of an election committee. He has intensified collaborations and networking at national and international levels, including FIP in practice, education, and workforce. He's represented MPS in the Malaysian Pharmacy Board, Malaysian Poisons Board, Medicines Advertisement Board, the National Patient Safety Council, and others, and has succeeded in taking MPS to the next level in MQuIT services. He has spearheaded MPS in facing COVID-19 pandemic and the National COVID-19 Immunization Program. Please join me in giving a strong round of applause to Dr. Amrahi Buan. All right, so as we proceed into this webinar, we wanted to make sure to tell you a lot about the background of those joining us today, because as you can see from their bios, that they are qualified to answer the questions that we present to them today. And I am hopeful that we all will be able to learn from the experiences, the challenges, the successes that they will be sharing with us today. Thank you, panelists, for being here. Colleagues, all around the world, we thank you for joining. Wherever you are, we want you to know that at the end of this panel, the learner, you and I, that we should be able to identify key challenges faced by academic stakeholders, specifically in Asia. We would like to describe the importance of the alignment of pharmaceutical education advocacy to policy change for the advancement of pharmacy practice in Asia. We would like to summarize best practices from stakeholders in the Asian region that could shape educational policy in the Asian region, and then identify collaborative methods that can assist with advocacy efforts to influence education policy worldwide with the FIP academic section. Perhaps you're joining today and you're wondering, why aren't they talking about my region? Stay tuned. We will have some other events from the different regions around the world. We're just starting off with Asia. Thank you again for joining us today. All right. So this is how the session is going to go. We will have the panelist introduction, which we've done already. We will have facilitated discussions with the panel, and then we'll have audience interaction at some point. Now, we will allocate about 15 minutes per each question. What that means, each panelist will be able to respond for maybe 1 or 2 minutes for each question. And then towards the end, we will be summarizing some of the thoughts and ideas and suggestions that you are sharing with us through the chat, or in the poll, or in the question section. Thank you again for your time with us, and we look forward to you engaging with us today. So, beginning with our first question, I'm going to start with Amrahi. What challenges did you face? What challenges did you face regarding advocacy and policy change in your region or country?
Thank you, Dayan. Bismillahirrahmanirrahim. Assalamualaikum. Good evening, good morning, and good afternoon to all of you, and also to our esteemed panelists and participant. I still take the opportunity to wish every one of you a happy World Pharmacist Day, 2023. And the reason why I pick this is the fact that pharmacists, strengthening health system is indeed a very big thing for pharmacists in Malaysia. And the thing that I want to share regarding this particular question is the fact that, in Malaysia, we have actually a unique health system, all right, where we actually got it from our British, where they are here, and most of our framework, legal framework, actually from the British, and since then, in the 50s until now, we don't really have a clear health policy in the country, and that is what actually affecting all of us in this country, more so of in terms of the pharmacists per se. And if we look into the current system, all right, when we have this dichotomous nature of the healthcare system, where we have the public system as well as the private system, we can see that and it's all silos, right? And it's good. Is really a challenge, for pharmacists across the board. Yeah. And we are talking about things that is happening in Malaysia at the moment in terms of the number of pharmacists at the moment. We have about 23,917 registered pharmacists in the register, of which 20,850 are actually practicing. Yeah, practicing. And if you compare between the what you call the private and the public, more is actually on the public. Okay, more on the public. And so this situation is actually causing a lot of sort of differences, okay, between what is actually practicing in the public sector as well as what is going on with the private sector. All right. So this is really a challenge for us, and because of that, we have actually I think as what mentioned by Toyin just now, I think one of myself as the president of the Malaysian Pharmacy Society, I think the challenge that we are actually talking in Malaysia is the fact that there's no separation of roles. Okay, especially in the private what you call private healthcare, primary healthcare in private sector. That means we are talking about dispensing doctors still in practice in Malaysia. So that's where the challenge is. So being the president of MPS, this is one of my main agenda. So looking into this, how do you actually look into it when you have two different systems, and how are you going to have in terms of delivery of services, quality of services is so different between the two sectors because they are all in silos. So all these years we've been harping about a proper health policy, okay, because we need to have one health policy.
Yes.
So after that, then what happened was last year, all right, the previous health minister we come out with what you call a policy in health, which is actually what we call here as the health white paper. And this is actually MPS has actually inputted a lot inside this policy, inside this health white paper, and I think more than a year we have actually participated in this, where we give all the inputs, okay, to the government, and thank God, on the 15th of June, 2023, all right, the Parliament passed the health white paper. This is the most important thing because it will affect everyone, especially future pharmacists. Okay, they are talking about a 15-year plan, whereby we talk about three stages, and I will not go into the detail of the health white paper, but the most significant, a few significant thing into the white paper is basically, to make sure that the health system will come into one integrated system across the board. Okay, so one particular thing that that I feel, that is going to really put up the profession along with with other colleagues is the fact that there is a shift, based on what happened during the pandemic. There is a shift of care. You know, we would like to see. I mean, all this while the practice has been even now into curative care, rehabilitative care, as well as palliative care.
Thank
But
you
this
so much.
but this current health-wide policy is been broader, meaning that we are going to shift to preventive and promotive care.
All right.
So, and this is in line with not only the requirement of the population, because we want the population to stay healthy, because our report card, or especially on NCDs, is not particularly good. So we have to do something about it. So we are now focusing into preventive and promotive care. So
Okay.
so this is something that that I feel that that will really affect the future. We have to put this into the education
Into consideration. Yeah.
system, and I think this is the biggest challenge. And other
Thank
than
you.
that, I would say that when I say that I have that most important issue about the separation of whole, we hope that with the establishment of the health white paper, our dream of having that role in the private primary health sector will be achieved. So let's pray.
Well, yeah,
One
well,
day.
good dream, good dream. Thank you
Yeah,
so much,
yeah.
Amrahi. I'm going to invite Dr. Robles to also comment on what challenges that they had faced in the Philippines. Thank you so much. That was Dr. Amrahi from Malaysia. Over to
Thank
you.
you, Dr. Toyin. It's a pleasure to be here to share with you our experiences in the Philippines. But at the end, I will also be mentioning about our position as regional organization or federation in the Asian region. Okay, so when we were lobbying for the new pharmacy law way back not only 2016, I think it happened way back, but the lobbying 2014, 2015, I would say that one challenge is the unfamiliarity of the government and other members of the society regarding the various roles played by the pharmacist in the healthcare system. And so therefore, there is really a need for us to be upfront and to be able to be appreciated for our roles. And this actually has impact on both the passing of the law as well as the salary, for example, the remuneration of pharmacists. So that's one challenge. The second is there's really a need for stronger regulatory implementation when it comes to pharmacy practice. Because one thing, there are many prescription drugs that are still being sold over the counter, which I think reduces the value of the pharmacist's role in advising patients with the right use of those medicines. The third is that there is a need for the government to set up new positions to encourage new scope of practice, for example, like clinical pharmacy. We have no clinical pharmacy positions in the government, and they're treated like any other pharmacy. So if we are going to uplift the salary as well as the recognition of Filipino pharmacists, they should have those positions in place. Now, the fourth, I think, challenge that we met is behavioral change among fellow pharmacists. Because for a long time, being an officer of the Philippine Pharmacists Association, offering regular continuing professional education. We have focused on those areas which are specified in the law as the new scope of practice. And because part of it is clinical practice, we focus on disease management. But in as time goes on, we think that we have to have more input on that aspect so that we could help change behaviors of people, especially pharmacists who are afraid to take on new roles. And then the fifth is the need for stronger skill-based training. While the Philippines had adopted the OBE, outcome-based education, I'm not sure whether this is really implemented at a level where the graduates are able to really practice, competently in the workplace. And for
Mm,
Asia, just something, at least part of your summary would be Asia. One thing that I noticed here is that in North America, you can talk the same language, but in
mm,
Asia, we are diverse in terms of language and culture. And that
mm,
I think is a challenge because we really have to identify our strengths and weaknesses in pharmacy education, but it
mm,
will take a while because we need to be able to put up that platform. And I'm happy that in Asia we have the Asian Association of Schools of Pharmacy, now headed by Dr. Inouye, and we also have PAPA academic section wherein it is headed by our Malaysian colleague, which really
mm.
looking at commonalities in the provision of pharmacy education. And the last would be the last challenge that I will mention is understanding the complex socio-cultural, economic, and political aspects which are really unique and complex if you talk of Asia. So really working in the region would mean that we really have to be strategic in our approach. And that's the reason why for this year we have embarked on having that survey about the status of education and practice in Asia, so that as an organization, the Federation of Asian Pharmaceutical Associations would be strategic in identifying what intervention can be done and helping countries handle their academic concerns. Thank you.
Thank you so much, Dr. Robles. Wow, what a lot to say. Lots of six things. We'll keep going. And I'm going to call right now, Dr. TV, are you ready, sir, to share what challenges you faced regarding advocacy and policy change in your region or country?
Yeah, first of all, thanks, Toyin, for the wonderful panel here. And I congratulate FIP, particularly Academic Pharmacy section, for taking initiation in organizing this type of webinar. And also, I'm happy to share, listen to my panelists, Yolanda Robles and Amrao Bong, and good information I'm able to get through them. Coming to our Indian scenario, right from beginning, we have a lot of challenges faced, particularly in pharmacy education, because the pharmacy education comes under Ministry of Health and Family Welfare here. The ministry used to give top priority to medicine, then dental, and then nursing, and last or least priority to pharmacy. That was the drawback when we think of advocating the government on policies or to bring the policy change. There is no strong supporting hand for pharmacy or pharmacy professional in the ministry. That is one. So, in spite of this, hardly we faced so many challenges, but able to come out of it. Particularly, we have three types of education system. One is diploma in pharmacy, undergraduate pharmacy, postgraduate pharmacy. Now recently introduced PharmD from 2008. Most of the community pharmacists in India are diploma holders. And the undergraduate and postgraduate, they were catering the needs of the industry. Nobody is coming to practice area or community pharmacy. And nearly 10 million pharmacists are there as a community pharmacist in India. And we try to upgrade their qualification from diploma to degree level by introducing a program called B.Pharm Practice in 90s, which was not got the nod from the clearance from the government, Ministry of Health. Then there is a lot of protest from All India Organization of Chemists and Druggists. And he was considered as a mere dispenser. We want to take the word dispenser, we want to make him as a community pharmacist who can serve the society, particularly in practice area. So our diploma in syllabus needed a lot of changes because it is not suiting the needs of the practice area. Again, we fought recently in 2021, we are able to make the regulations. The diploma holders are trained in practice areas majority. Earlier routine subjects were deleted and new subjects were introduced and mode of training also changed. And this is one challenge we face from upgrading the diploma qualification to degree. Now, now we have come out with the BPharm practice program, 3 years, a part-time program where we want to make all our diploma holders to upgrade their qualification to degree. That was in pipeline. Yeah, that was in pipeline. Down the year by 2030, we want to upgrade the qualification of existing diploma holders to degree holders. That is one. And they will be serving only community pharmacy or hospital pharmacy. They are not going to industrial pharmacy. That is one. And what are the other challenges we faced is we have a dual regulation system of regulating the education. We have a Pharmacy Council of India which regulates pharmacy education, and we have All India Council for Technical Education. The problem is whether pharmacy is a technical education or medical education. That was the dilemma till 2018. But we are supposed to have both the approvals of the regulating bodies. That is the challenge faced by so many colleges and universities. But in 2018, we are able to come out of technical education, and we are now with only one regulating body, Pharmacy Council of India. That's why we are not able to make so many changes in the education system all these years. Now, because of the dual regulation of AICTE and PCI, now we have come out with our own regulation. In fact, our BPharma syllabus differs from area to area, college, university to university. We don't have the regulations of BPharm or regulations of MPharm. But in the year 2014, it is a golden era for Indian pharma education system. We have come out with BPharma regulations, MPharma regulations, teachers regulations, and with a uniform syllabus throughout the country. That was the
congratulations. That's a big accomplishment.
Yes, big accomplishment. And even we are trying for separate Ministry of Pharmaceuticals, which can control all the exports, education system, everything. And again, we are facing a lot of challenges. I think down the line, 3-4 years, we are able to succeed in this challenge. Once the Ministry of Pharmaceuticals established, definitely all the role of pharmacist will be defined clearly. We want to have the support from the FIP because in national health policy, the role of pharmacist was not mentioned in India all these years. Only after our advocacy group intervention, the role of pharmacist was included. So we want to inform the government, the FIP WHO goal, universal health coverage, and the role of the stakeholder or role of the pharmacist to be explained to the government through our advocacy. That's where they can give more prominent role to pharmacists in India. That's what we are looking at.
All right.
And,
well, sorry.
And we have come out with Pharmacy Practice Regulations 2015. There we have mentioned the role and responsibility of pharmacist, and with his scale, pharmacy scale, everything, we have government has given the clearance, and we are waiting for the other state government to support and implement these regulations. Once these regulations implements, all the roles of the pharmacist and responsibility of the pharmacist is clear with good monetary benefit. That's what we are looking.
Thank you so much, Dr. Narayana. Lots of things to share there, and congratulations again on the progression with the curriculum. At this time, I'm going to check to see if we have Dr. Emmer Ken on the call. Let's see if we've been able to get him on. We've been having some technical difficulty there. If not, I'm going to go on to question number 2. I want to thank the digital events coordinator for doing their best to make sure we could get Dr. Ken on. Thank you so much. So we can hear some great ideas and suggestions from Japan. Question number 2, colleagues. And as we get the screen sorted, do you know how many countries we have represented today? If you're just joining us, this is the Academic Pharmacy Section digital event focusing on advocacy and policy. We have people from all around the world: South Korea, Nigeria, Philippines, Georgia, Lesotho, Greece, Zimbabwe, Ethiopia, Venezuela, Nakuru, Stanford, India, Oviedo Fields, Bangladesh, China, Pakistan, Rwanda, Yemen, Indonesia, Afghanistan, Kenya, Taiwan, Ukraine, Somalia, Malaysia, Lebanon, Dubai, and of course the US. Welcome, everybody. We're now on question number 2. What are the best practices that you've considered related to advocacy and policy in pharmacy education? Dr. Mari, you're going to start. We have just a couple minutes. Thank you.
Thank you. Thank you, Toyin. Yeah. I think after listening from our colleagues from Philippines and also from India, from India, I would say that, it's very important that we talk about what actually is a pharmacist. That is a very important thing that we need to know, because as we can see, we have to be very clear about what is a pharmacist. Okay, I just want to share with you some acronym, so that at least we can have some idea, what when you talk about pharmacists. So actually, pharmacist is a professional, honest, accountable, resourceful, matured, accessible, confident, intelligent, sincere, and trustworthy. So with the acronym, you can see, what is actually the need of the patient. I think it's very important. At the end of the day, we have to go back to the thing that our professional or our profession exists because of patient. All right. So this is very important. So largely, we are actually known as medicine experts because we under the BPharm program and so on and so on. We are actually medicine experts. After that, and I also mentioned about the role of pharmacists as guardian of medicines, because taking medicine is actually a risky business, right? And again, I would say that no doubt that we are actually a healthcare professional, and we need to work together with other medical colleagues and any of the allied health, what you call professional, yeah. So I think if we look into what is happening in Malaysia per se, pharmacy practice is actually across the board, meaning that we cover along the whole value chain. All right. When you talk about even from the start of research and development, okay, you talk about regulatory, you talk about manufacturing, you talk about logistics, you talk about marketing, you talk about hospital pharmacy, and then you talk about community pharmacy, and one more thing, public health. Okay, I think I did mention about the health white paper because of the fact that will shape, where actually the pharmacist can play a vital role inside the healthcare system. Yeah, and so I think the pharmacy school, or when you talk about pharmacy education, we want the what you call the education to actually respond to this, and this is very important. So that's why in Malaysia we are quite fortunate for the fact that when you talk about the BPharm program, for example, this is actually basically standardized, be it in the public sector. As I mentioned, we have 6 universities under the public sector, and we have 14 in the private sector, but all been regularized, okay, by two bodies. One is actually the Malaysian qualifying agency under the Higher Education Ministry, and the other one on the practice side, on the professional side, is actually the Pharmacy Board of Malaysia, or Malaysia Pharmacy Board. of which I am actually one of the member for so many years. Yeah.
Thank you.
And it's important for that, that the education got to understand that there are few things that we need when you talk about practice. Number one is ethics. So what we did in under the what you call the pharmacy board, we have actually developed the code of ethics already. Okay, which actually patient focus and is they have 7 elements there, and MPS has inputted a lot in that in that code of ethics. So that's one, right?
Thank you.
And then the second one is basically the term professionalism. I think this is very important for the fact that when we talk about being a professional, I think all of us have to portray a professionalism.
Yes.
We are one. We are not not other than us. We are not doctor. We are not nurses. We are not anything. We are pharmacists. So these are so once a pharmacist is always a pharmacist. Okay, and so as thing goes into the future, it can be very challenging when you talk about the legal framework. All right.
Thank you so much.
So we are talking about, for example, now we are talking about even specialization. So things that have to be done, and then we have to go there. So the next point will be competency-based training. Okay, so and these are things that that need that we look into. It's not good because we're talking about future pharmacists here, and they have to pay, and it has to be future-proof. As I mentioned earlier, when you talk about the health white paper that will last for 15 years, so if we start from this year, so we're going to prepare the future pharmacists to face the changing health system in Malaysia. Yeah,
right.
And I think across the globe, when you talk about our practice, right, we are talking about things that happen, especially during the pandemic. Okay, during the pandemic, things are forced into us. Okay, when you talk about, for example, e-pharmacy,
right?
Okay, e-pharmacy, has come into picture. After that, we talk about home delivery,
right?
to people on the when they have to be in their houses, quarantine, and so on and so forth.
Those
And
are great things.
and one more thing is basically telepharmacy. So all this has been forced on us when during the pandemic, but especially in digitalization of pharmacy in when you talk about IR 4.0 or AI. So I think this is something that actually affect even our practitioner in Malaysia. Suddenly,
thank you so much.
You remember when I mentioned about the separation of roles between the private doctors and pharmacists, suddenly during the pandemic, because of digitalization, there's such thing as e-prescribing, where when that means we have to mix telemedicine with telepharmacy. All right, and we are talking about e-prescription. And with e-prescription, we are now able to follow the legal framework. Because all this while, okay, the pharmacists cannot even dispense medicine, okay, which is actually prescribed medicine. Okay.
Thank you so much, Amrahi. Let's give him a round of applause. We want to make sure we hear from some of the other countries as well, given our time. Thank you so very much for sharing with us some of the best practices in the country. I'm going to call Dr. Robles now to share with us even from the Philippines. Thank you so much.
Hello. So I'll be answering the second question. And I think if I have to reflect on what we did in our country, I realized that we have been systematic in connecting policy, practice, and education in a way where we prioritize policy framework, because the policy framework will actually impact on pharmacy practice and education. So we decided to start with it, and so we were able to come up with a law. Now, the law will define the scope of practice, and it even includes those roles that we don't have yet in the Philippines. But because we have been aware of the other roles of our participation in FIP, for example, in other regional conventions and conferences, we were able to have an idea what's happening outside and what we need in the country. And so from the scope of practice, once you have it in the law, then you will be able to specify or look at the competencies required to fulfill those roles. And with the competencies, of course, this will be measured, and the law also specified what will be the context of the licensure exam, the content of licensure exam. And so with that, we are, as people in the academe, would be concerned with how we will revise the curriculum. And so we did it. We tried to follow the FIP guideline with regards to really balancing between local needs and also looking at the advancement of the profession at the global level. But at the same time, since we are into outcome-based education in the Philippines, we are very concerned with the teaching learning methods that will support the acquisition of skills, because these are new, and our faculty, some of them are not competent to do that. We need to look at the collaboration aspect, and that's why we look at collaboration with our regional colleagues in the academe, and also we have invited several from FIP to help us out, and also universities from different countries. No, so we really are after really making a very relevant and responsive education. And currently, we are concerned with how to fulfill the roles of the pharmacies under the universal healthcare, specifically the primary healthcare role. So this is where we really need some really improved curriculum, and also we need experts and advocates to help us out. And so I think the second best practice is more on the collaboration. I think what we have in the region under FAPA and under AASP or ACCP had created that friendly atmosphere wherein we talk about practice and education, and yet we act as friends. And so it's very easy to really share their practices. And so that, I think, is one thing that we like. And so we just hope that this collaboration will continue for some time.
Thank you so much, Dr. Rose, for the concise response there. We truly appreciate that. I'm going to invite TV to give his response to question number 2, best practices that you experienced in India. And we'll look forward to hearing from you. The other questions that will be coming up, we will probably have just 1 or 2 of you respond to the subsequent questions so that we are mindful of our time. Dr. TV, best practices.
Yeah, thank you, Toyin. As our community pharmacist, I already told you, he is concentrated only on dispensing. There is earlier, there is no role for a best practice, what he can contribute to the society at large. But a blessing in disguise during COVID-19 pandemic period, and our pharmacists worked day and night and served the community and society at large. And in fact, the pharmacists are the highest number of healthcare professionals served during COVID-19 pandemic in India, which was well appreciated by the Ministry of Health, Prime Minister, and even Nitin Gadkari, another minister. Then pharmacy started getting image and recognition in society. Earlier, the community pharmacist is not at all considered as a professional. He is considered as a trader. After this COVID-19, the services rendered by pharmacists are well received, and they recognize him as a professional now. The change has just begun. That's what I can say. That is one. And even we are thankful to FIP and FAPA for the guidelines issued during the COVID-19 pandemic, what the pharmacist is supposed to do. And it is really useful in training our pharmacists. Our pharmacists, they served during COVID-19 in primary hospitals and even some government hospitals. That is the immense contribution of our pharmacists. And what the doctor's perspective earlier, he is not recognizing the diploma in pharmacy, because the diploma in pharmacy is a 2-year program in India. But now the PharmD professionals started coming into the market. The PharmD introduced in India in the year 2008 with a 6 years program, 5 years education and 1 year internship of 1,450 hours in a hospital. And doctors started recognizing the value services given rendering by the PharmD professionals. So we want another best practice. Our PharmD professionals should be trained, equipped on the latest development taking place in developed countries. And we want to inject them with the healthcare team so that our pharmacists also will be recognized as a healthcare professional in future in India. So for this, I want the support from the FIP, particularly academic pharmacy section. Okay. We can have a teacher exchange program or student exchange program or MOU and collaborations. For that, we are looking to train our PharmD professionals, particularly in the practice area. That is what we are looking.
Thank you so much. And we note that request that you do look forward to having support from FIP with regards to training some of the pharmacists. I can let you know that we do have a project that the academic section is leading with Dr. Manzi Doshi and Dr. Kar Schneider and some of the key players in India, Dr. Suresh. And basically, we want to make sure that you know that we are in support of the work in India, and we look forward to collaborating further. Looks like I see Dr. Emma Kenichi Nui. Thank you for joining us, sir. We're so glad. Apologies for the technical difficulty there. We're glad you're here with us. We just concluded the second question, which said best practices that have been incorporated. What are the best practices you considered related to advocacy and policy in pharmacy education? Would you be so kind to share with us from the Japanese perspective what the best practices are you've considered related to advocacy and policy in pharmacy education? Just for 1 minute, perhaps, if you are able.
Okay. Yeah, sorry. Yeah, finally, Dr. Mai helped me, and I apologize very much. So, but anyway, I'm so much upset. So, but
we're so glad you're here. We're so glad.
Discussion and but just step on. So, but anyway, this time I attended the FIP meeting, and Rolf Artorier organized a symposium. I was one of the speakers, and I introduced the Asian Association School of Pharmacy and also Japan Pharmaceutical Association. So anyway, I'm both present. So I introduced both societies, activities, and what's going on, and also so another school of pharmacy. But anyway, in Japan, you know, we are still struggling. So, you know, so 4-year program to 6-year program about 10, almost 15 years ago, we changed it, and going pretty well. Absolutely. And in order to 6-year program, so activity of pharmacists is grade up very much, and especially hospital pharmacist is very good. And but the community pharmacy is still not so much. So anyway, collaboration and exchange information, that's very important. And also, most important point is the school of pharmacy. So teacher themselves should change much more. So my background is a hospital pharmacist, so I cannot enough. I can enough confidence, but School of Pharmacy professor and the associate professor, they should change much more. That's very important. And also, our recent point is in interprofessional relationship and collaboration. That's very important. So anyway, we are going well, but we need a little more time. Sorry, just time over.
That's
Sorry.
no problem. Thank you so much, Dr. Ichinui from Japan. We are so glad you're here with us, and I know that you will have an opportunity to share further. I'm going to go to question number 3. Looking at our time, I wish we had more, but question number 3 says, what is an example where you used advocacy in your region or country to shape education policy? We would like you to please describe the implementation process, successes, and challenges. I want to start this time with Dr. Yolanda Robles to help us with an example where you used advocacy in your region or country to shape education policy. Then I'll come back to you, Dr. Ichinui.
I think the one very recent advocacy which we actually that succeeded into a full program at the national level is the immunization by pharmacists, because it used to be that we are not part of the immunization team. It's more of the doctors and nurses, midwives, but not pharmacists. But as I've told you a while ago regarding the framework, the policy framework, we have already included immunization as part of the role of pharmacists in the law. And because it is there during the pandemic, it became something to which the government hold on to, and we were invited to join the immunization team. But that did not, but that is the positive side to it. That's the success part. But let me tell you, prior to that, we've been advocating immunization since 2014, since FIP CEO Luke Bisanson and also Emma Paulino. They came over to the Philippines as our speakers in our PPHA convention, and they shared to the FDA that immunization by pharmacists is one successful role that they hold in public health. And so, it was a challenge to FDA. And so what they did was to issue an advisory. Why not try community pharmacies to become immunizers? And so we took it in the national organization. We took it as an opportunity. So we decided to present the successes in other countries and what we can do. And we already provided a training program. So the organization, PPHA, had commissioned the University of the Philippines College of Pharmacy to develop the modules for training of pharmacists. And so it went on for some years, and we wanted to be accredited. The PPHA wanted to be accredited for that particular training, but it took some time. It really takes time to convince regulators to allow us to do it. But when the pandemic came and the government has to inject 75% of the population, they lack the number and the experts to, skilled health workers to do it. And so they invited us. So, the process became very quick because the Department of Health had to talk with the Professional Regulation Commission, who's supposed to accredit us to do the training, and also talk with the Philippine Pharmacists Association, who will conduct the training. And it went on smoothly in that area. And so when the COVID-19 vaccines came in 2021, we already have a training in place for pharmacists who wanted to join the immunization team of the government. And we even expanded our training modules to include one module specific for COVID-19. And so right now, I think we have more than 1,000 pharmacists who are certified as immunizing pharmacists by the Professional Regulation Commission. So what is the relationship to education? Well, because it is already a role that people see in that where pharmacies are very useful, we have incorporated it in the curriculum. And so
Wow.
our curriculum should be able to teach our students before they graduate how to immunize. But again, following the American, let's say, model, they will still have to be accredited. They have to pass the exams and the requirements for immunizing pharmacists. So I think that was one
That's a
good
great example.
example.
That
Yeah.
is a great example. Thank you so much, Dr. Robles. I know we still have 30 minutes on this session, just in case people are wondering. This is a 1.5 hour webinar, and that was a perfect example of advocating to get results, to put things in the law, change curriculum, and you were ready. And then, now you get people through to the licensure. And so Dr. Ken Ichi-Inoue, would you be so kind to share an example where you used advocacy in your region or country to shape education policy? You're on mute, sir. I think you're on mute, sir. Doc, you're on mute, sir.
Okay. Yes, we are, so, okay, I have to say one more important point is, we started 2006 and 2012 is the first graduation. And so now we will change the core curriculum again. So that's new curriculum will start next April. So, so from next new student will take a new core curriculum, and this curriculum change is the Ministry of Education and organized. And so medicine and pharmacy and dental school, at the same time, we changed the core curriculum. Very amazing example, I think so. So, so nobody know, but I believe now, great change and collaboration of those in interprofessional group. So I think medical area and the pharmacy area and the dental area is a collaboration much more, and so probably much proceed much more, and that's a new point. And now all school of pharmacy in Japan are struggling how to start the new curriculum. So this year, Japan annual meeting of Japan Society of Education very active because new curriculum and the new system. So everybody is so interested. So I think so very soon we will get a good result. And another point is research. So today nobody discuss about research or scientific basis something. I think even pharmacy, we need science. That's very important.
We need science.
Yeah. So absolutely, I believe. So in Kyoto Pharmaceutical University, when I was present, I delivered a very lecture when I started. So that means pharmacist scientist. That means pharmacy with research mind. That's very important because I worked at Kyoto University School of Medicine. So professor and director, So I sometimes discuss with the medical doctor and also in the hospital. So they always say that in Kyoto University School of Medicine, not only clinician, but also science is important. So
Science is important.
yes, they also always said their direction is physician scientist or surgeon scientist. That's very
Mhm.
important. So
Yes.
I learned that year 2007, 3 years before my retirement. So just 6-year program started. So at that time we used, I proposed pharmacist scientist should be very
Pharmacist scientist.
pharmacist scientist is very important in future. So
Yes.
I believe such word. But when I propose some US friend, so for instance, UCSF and Buffalo, and at that time they said just laughing, something like that. But,
Yeah.
so anyway, such terminology or no word in the United States. I believe so, but I think that's very important in future. And
Yes.
physician, surgeon, they also scientists. I think so, in the world like that. So especially in Kyoto University, it's a very strong, powerful opinion leaders. So I
Yes.
learned that point. And when I was appointed as a Kyoto Pharmaceutical University as a president, at first day, I delivered such a lecture. So
Congratulations. That's impressive. That's very impressive.
Yeah, but our outcome not enough. So I think so from now, so science-based something is very important.
Yes, I agree. Thank you so much, Dr. Emma Kenichi Noe. Thank you for your advocacy. Thank you for taking ideas and sharing that with pharmacy. Thank you so much for being here today. At this time, we're going to go to our last question. We want to be mindful of time, and we would like to start taking questions from the chat. So if you are thinking about what question you want for the panelists, start using the chat feature, please. And at this time, I'm going to call Dr. TV Narayana. How could the FIP academic section assist you with influencing education policy in your region or country? I know you already shared something with us previously, but curious if you would like to add to that. Dr. TV?
Yeah. And see, earlier I told you the system of education in India is a diploma in pharmacy, B.Pharm, UG, and PG, and PharmD. And regulations, it is governed by the pharmacy education regulations. And every 10 years, we used to change the regulations to update the syllabus or whatever. And if at all you want to change in between, it is not at all possible because our earlier regulations were linked with the Pharmacy Act. Suppose if you want to change a single word or comma or full stop, it has to go to Parliament, which takes lot of time. That is the earlier scenario. But now, using our advocacy group and showing the international exposure or role of the pharmacist at international level, we are able to de-link act and regulations. Now, we can change the syllabus as and when required, the need of upgradation of the training of the pharmacist. We can change it. That is one big success through advocacy. We are able to do it in India. And about the PharmD, when up to 2004, 40% of our Indian pharmacy students, they used to go to US and practice there. More than 40%, every year, more than 10,000 students. Other developed countries, they used to go appear for the NAPLEX or board exam and work as a registered pharmacist there. But from 2004 onwards, they were denied opportunity of appearing for exam because of the first batch of PharmD came in the US in 2004. From 2004 onwards, our B.Pharma students were not allowed, given opportunity to appear for the exam. That was the reason to start PharmD program in India.
Ah,
So in 2004, we have taken the information from all the developed countries, how the family people are doing. We have submitted our request to the ministry,
hmm.
where ministry said, no chance. India don't require family now. It is enough. We have B Farm, undergraduate and postgraduate. Then through our advocacy, we used our students to go for agitation. Then ministry asked Pharmacy Council, that time led by our dynamic leader, Dr. Suresh, is the president. And he formed a committee and asked all of us to go to Australia, Singapore, US, UK, and see how the family people are serving the society there, how best we can take from that and implement here in India.
And apply, yes.
Yeah. And that
So
was the
how
reason.
can FIP help in that situation?
Yeah. And we have come back and we have prepared the draft syllabus, submitted to the ministry. Then ministry told, where are the teachers to teach the students of family? Where is the training to the teachers?
So
Then
we
we
need to. Mhm.
then we took the help of trainers from Australia and through ISCP, many experts from US also they came, various universities. They trained with the different modules to our pharmacy teachers first. About more than 10 modules were conducted by ISCP Dr. B. Suresh. I think you also came once, and many people from FIP came and they trained the student. That is one.
So-
And
So we actually don't have too much time left.
yeah,
And
that's
so,
all. My last word, one word. And for the latest developments like telepharmacy, telemedicine, and digital health, these are required. Some of the training from the experts from FIP. If we want to associate with FIP Academic Pharmacy Section to be a partner in training the students in the latest developing areas like digital health, telemedicine, and pharmacoeconomics, something like that. That's all from
sounds
my part.
great. We will be happy to support, and we're collecting all this information. Please feel free to put in the chat. We may not get to all the questions because we see that there's so many people who are engaged on this platform. Our fantastic coordinators have summarized some of the questions they're seeing, and I'm going to read out one or two of those questions now. How can we bring pharmacy curriculum at the same level of being standardized throughout the world? In light of recent global health crisis, how can pharmacy leaders contribute to building a more resilient healthcare system and global health security? So I think we will have time for the first question. I'm going to start with Dr. Amari. How can we bring pharmacy curriculum at the same level of being standardized throughout the world, please? Maybe in 1 minute, if you will be so kind.
I think after listening to the fellow panelists, I think I agree that that we have to have standardization in terms of pharmacy education. Yeah, even in Malaysia also we when we produce our B Farm graduates, yeah, so we have quite a generic sort of curriculum, but we're actually looking into it and to make sure that, as I mentioned earlier, we are able to be able to serve the all sectors of the pharmaceutical industry. All right, so I think this is very, very important, and specialization is also something that we need to look into. Certification is very important to micro credentialing and so on and so forth. Yes, MPS also have done a few, all right, in terms of micro credentialing, and we hope we can share with FIP. So I think standardization is very important so that that people can recognize. And I don't think our workforce or the number of pharmacists is enough, to support the needs. That is my frank on it. But
Thank you, sir.
we still need to standardize. Okay, and everyone can serve. Given, I think the word is like this: the delivery of pharmaceutical care or pharmaceutical care delivery has to be consistent to all part of the world. Delivery of pharmaceutical care. No other healthcare professional can provide pharmaceutical care delivery. Thank you.
Thank you so much. I'm going to direct the next question to Dr. Emerken Ichinui. In light of recent global health crisis, sir, how can pharmacy leaders contribute to building a more resilient healthcare system and global health security by embracing advantages in technology such as pharmacogenomics or personalized medicine?
Okay, that's a great question. And so I think just briefly say, so I think so pharmacist has various abilities because so various directions. So even medicine, drug, but also other healthcare, and so I think so still going on, and we should move together. And so this time in when I attended the FIP, I thought that so of course before I attended FIP, but this time so since 2019, so I think it was very impressive, and so we should join together and discuss. And partnership and collaboration is very, very important. So you Toyin suggested some huge project, but this meeting there are no such sessions. So I disappointed a little bit. So this time mainly practice. So BPB session is of course very active, but the BPS not so much active. So I think that's problem. So I don't know what's going on, but anyway, that's my impression. But anyway, this FIP ed is very, very important, and so we should go. Let's go together and change. So this is a good timing after COVID-19 pandemic. So we can do a lot of things. And I remember
do a lot of things.
Okay. Year 2019, President Jordan delivered a lecture, the opening lecture. I believe his word. The century of the
20th
21st
century. 20th
is
century is the century of pharmacists.
Oh yeah, that's yeah, exactly. So I was very impressed. So I'm keeping that word. So sometimes that word to Japanese president of pharmaceutical study Nobuo Yamamoto, and in Japan you should say that word, very important. So I think in future, so FIP go straight ahead and with enough confidence. That's my answer.
Thank you. Thank you so much, Emerken Ichinui, Dr. Amarahi. Thank you so much, Dr. Robles, Dr. TV. What an excellent session today. Everybody give them a round of applause. At this time, we are going to go into the summary of our session today. I'm going to invite Dr. Chonwai to help us with the highlights, takeaways from our panel today. You can see it also on the screen. Dr. Chonwai, are you able to let your voice be heard?
Okay, thank you. Thanks, Toyin, for the kind introduction. So just to wrap up, so we are very grateful to all our speakers and panelists and Toyin for facilitating these sessions. So a quick summary, we talk a lot about the regulation restrictions related to pharmacy degree. And there are some things that we might need to iron out related to regulations pertaining to how to obtain the pharmacy degree. And we talk a lot also related to how to implement competency-based training for pharmacy curriculum. In fact, recently the 81's FIP Congress, there is also sections particularly to address the competency-based out curriculum. So we also discuss about the importance of collaborations with others professions. And more importantly, we also highlight the importance of interprofessional learning. So in these sessions, we also discuss about the role of pharmacists in advocating public health related issues. This is something very close to us, especially now we are in the post-pandemic area. And last but not least, we are very fortunate, Prof. Inuri also mentions about the importance of research and also pharmaceutical sciences in the current pharmacy curriculum. So I pass back to Toy. And those other questions that we didn't able to answer, we will still be taking notes. As Jenny was mentioned, we're going to compile in the toolkit as well. Thank you very much. See you all later.
Thank you, Dr. Chung. I truly appreciate you. Colleagues, everyone all around the world, one thing we want you to take home is advocacy takes time. We want to thank everybody, all our speakers. Again, let's give them a round of applause. You can see the challenges they face, the tenacity, their dedication to the profession, their courage in pushing forward and advancing the profession in spite of the obstacles that they were facing. Thank you so much for continuing to push forward in Japan, in Malaysia, in India, and in the Philippines. We appreciate you for sharing your examples today. Colleagues, we know you are doing the same kind of work where you are. Please fill out the survey link that will be posted to the chat. We want to know, what kinds of things you are doing in your respective areas. We understand that there are lots of best practices, challenges, and ways we can support you even in advocacy, policy, and change management. So please make sure to fill out the survey. It'll be put in the chat in a few seconds, if not already. And we want to let you know that we will be having another session on the Africa region, so we can learn from what's going on there, what the challenges are, and how we can support specifically around education policy. We want you to get involved. Let our series coordinators know how you want to share your time and talents. Join our working group on policy and advocacy at the academic pharmacy section. And we wish you a wonderful, wonderful rest of your day. Good morning, good afternoon, good evening, or good night. Thank you again, everybody, and have a wonderful rest of your day. So our panelists will stay on for a debrief while everyone else exits. Thank you.
Thank you.
And I want to acknowledge the additional countries that joined: UAE, Budapest, Gemma. Welcome. We thank you for joining us. Thank you, everybody.
Thank you.